But one area that has taken critical center stage, Ijoma, is the COVID-19 pandemic. And it has brought the health sector into limelight. Whether that was desirable or it wasn't, it's an entirely different thing.
And even now, it's a bit of the celebrations and all are overshadowed with the figures now a bit above 14,000. The president there also talking about Nigerian scientists tasking them to find a COVID-19 cure. Ladi.
We're being joined now from our Abuja studios by one of those who has been guiding the response to this COVID-19 pandemic. That's the Minister for Health, Dr. Osagie Ehanire. Many people now know you. Thank you so much, Honorable Minister, for joining us this evening on the program. Let's begin by asking, where exactly are we with COVID-19 at the moment?
Well, where we are is at the moment of trying to control of the outbreak. You know that it has spread to virtually all countries in the world now, and all countries are grappling with it. There are some countries that thought that they had reached the peak, and then they are having what is called a second wave. We are still increasing. We are gradually still getting more and more cases, 14,000 positive, just over 14,000 positive by today, 387 fatalities. Where we're going is not clear, but we respond very closely by observing the trend, not only internationally, but in our country, and taking measures to be able to make sure that our health system does not collapse under the weight. Meanwhile, we have done very well. We have been able to give attention to the hotspots, to the high burden areas, to zero in on those places where we think that, where we have observed that there is a serious, the seriousness of the outbreak is particularly poignant.
All right, Dr. Ehanire, one of the things people worry about is a cure. And they're asking, when is this going to happen? Where are we now in terms of the clinical trials, either orthodox or alternative? A number of people had brought in some sort of cure, which we said NAFDAC would have to validate. Where are we now?
There are trials going on all over the world. It's not only in Nigeria. All countries are rushing first to find remedy, secondly to find a vaccine. And there is not one yet that is accepted by the World Health Organization, which is a global, let us say, referee and marksman, they mark all the development going on in the world. But as far as we are concerned, we are reviewing all the options brought forward for possibilities of being remedies. Recently, we received samples from Madagascar, which we have given to our research centers. The Nigeria Institute for Pharmaceutical Research and Development, the Nigeria Institute of Medical Research in Yaba, and NAFDAC, and also the organs at the Ministry of Science and Technology looking into these herbal remedies. We have not got any results as yet. And the indigenous trials that have been tried, the indigenous herbs that have also been brought for trial, have also not yet yielded a result. As far as the other medicines are concerned, we are working with the World Health Organization Solidarity Trial to see what medicines may work. We have tried chloroquine, we are trying hydroxychloroquine, azithromycin, and some other combinations, including antiretroviral drugs, which are believed to have the potential to halt the growth or stop the growth of the virus. Some of them are said to have worked in vitro, that is to say outside of the body, but it is not yet fully confirmed that they also work inside the body in vivo. The tests are still going on. We do not have any conclusive reports as yet.
When you speak about COVID-19, Honorable Minister, what many people tend to try to highlight is the fact that now we're in a race between life and livelihoods. That is the balance that's been tried to be established. Would you say at this point in time that this is a calculated gamble, easing the lockdown when we may not have reached the peak of cases, as you've just identified for COVID-19?
Correct. That's a very good observation, in that you are trying to balance lives and livelihoods. The virus is one of the most easily spread viruses that is known to man, and it very easily will jump from one person to another due to close proximity. That's why distancing is something that we are stressing. And because of that ease of transmission, it necessitated lockdowns that are meant to limit movement of people from one place to the other, because the virus has to be carried from one town to the other, from one house to the other. And that lockdown, again, affects the economy. You are not able to go to farm, you are not able to go to work. So creating that balance between allowing the economy to continue and then lives not to be put at risk is it's not an easy thing. Those who have to make the decision really have to put a lot of things into consideration. The president has taken a very wise step in easing the economy so that things can go on and people can make a livelihood, and at the same time ensure that measures are in place to make sure that there is no excessive risk to lives. That is why we, on our own side, have continued to emphasize the non-pharmaceutical interventions that need to complement the easing of restrictions on movement. So if we are not going to move around, we must take measures that protect us and protect our neighbors and our families. The mask is the first one. The social distancing is the second one. That is something which in reality is not practicable everywhere, but people bear it in mind. And then washing your hands frequently. Again, that is not always practicable where you don't have water. Using sanitizers. Sanitizers abound now. If you have a good quality sanitizer, you are better covered than someone who has none. So these are measures which we are using to complement the risks that may be going along with reopening the economy by letting people move around.
Dr. Ehanire, while you look at the measures, and one group that are worried at the moment are healthcare workers. They've been worried for the last 21 years of democracy, etc., about their welfare. Is there any news right now that we have COVID-19 on those the hazard allowance that was to be paid to them? I know that the Minister of Labour had said that by today it will be sorted. Just in case you have any information on that, the hazard allowance for health workers?
Yes, we're worried about all Nigerians. We're particularly worried about our healthcare workers, who are the ones handling the virus, the fight against the virus. They are like the people in the engine room. We're also worried about vulnerable citizens, who are the most common potential victims, those who have underlying ailments, those who are past the age of 70, those who have previous infectious diseases like HIV, tuberculosis. But to come back to the healthcare workers, they are the ones who we pay particular attention to. We are very conscious of making sure to have necessary personal protective equipment available for them. We make sure that they work in shifts, and after the shift they all have a period by which they are assured to be virus and infection free before they go to their families. And we also have provided the social measures like life insurance and the hazard allowance. Now all those are measures which are already established and they are signed. The details are being worked out. You know that there are processes in everything. They have to be made available, they have to be allocated, you have to do the paperwork concerned around it. So I spoke with the Honourable Minister of Finance just yesterday, and she has assured me that yes, the processes are on track, and by next week they will have finished all the formalities. That is the way it goes when you are dealing with finances. But the important thing is to know that the start date is already guaranteed. So whether you get it today or next week, the date you are going to get is going to start has already been agreed upon, and the payment is assured. So health workers need not worry, need not be have any concerns that they will not be paid.
primary healthcare centers have been brought to the fore now because in a lot of the country, many people go to those primary healthcare centers. So in this particular situation, would you consider it important for us to focus on those primary healthcare centers, especially because as COVID-19 is ongoing, other ailments are also there to be treated?
Again, you are perfectly correct in that, that we did observe at the beginning that on the one hand, the fear of COVID-19, and on the other hand, the too much focus on COVID-19 led to the neglect to other disease patterns and the attention given to things like malaria, normal diarrhea, dysentery, even the attendance for antenatal clinic and immunization all began to drop. And healthcare workers who were not familiar with infectious diseases did not, at the initial stage, quite know how to handle patients who were suspected of having COVID-19. And some of them did not have the index of suspicion to know what this might be and how to handle this case differently. So people did get infected at the beginning, and we had that phase where we had to have a lot of health workers in isolation. Now, the stage we are in is the stage of community transmission. COVID-19 has moved from the time when it was in a disease of people who came from abroad, which it was thought to be the big man's disease. Those who had traveled abroad, they came back with the virus, and they and their friends were the ones where contact tracing was being done. And some people at the grassroots felt they were not, it was not their concern. But right now, it has spread to every nook and corner of the country. The disease is now, you can almost say, indigenized. And people who do not have a passport, who have never even been to the airport, are now contracting this imported disease. So the era of the primary healthcare center has come in. We have brought in a primary healthcare center with all their contacts at the grassroots level for tracing, tracking, and community engagement and risk communication. That is being brought in now and used very efficiently, particularly in high burden states. The head of the NPHCDA, National Primary Healthcare Development Agency, went to Lagos and Ogun just about a week ago to engage those states in how to put these assets at their disposal. We have also sent a team that is helping to put these assets at the disposal of Kano State. You know that these three states are particularly high burden states, including the FCT. So yes, you are correct. The primary healthcare network, and in fact, the boarding schools of our the boarding hostels of our secondary schools are going to come in useful in this stage for observation centers for those COVID-19 positive persons who do not have symptoms or who do not have who have only mild symptoms, to keep them at a place where they will not be at risk of infecting other citizens. So yes, the primary healthcare center is playing an important role at this stage.
Dr. Ehanire, as a man in the saddle of the ministry handling this pandemic, let me put it that way, how do you think this has impacted on Nigeria from your perspective, and what shape do you think the health sector will be in when this is all over, seeing as, you know, we all know the shape it was in at the beginning?
The impact of COVID-19 on the health sector is going to be global, it's going to be universal. There's not one country that is not going to suffer, have suffered from this pandemic, because the effect on every health system has been devastating. You know, many otherwise resilient health systems in countries which we respected all collapsed. You saw patients on the ground, they just could not cope, they were overwhelmed. And that is what we have been trying to avoid in Nigeria. It is come out that it's not so much how strong a health system is, but how easily overwhelmed it gets. And the lessons learned from this entire outbreak, not only in Nigeria but in other countries, is going to help to reshape the health sector. In our own case, we are going to be using the lessons learned to improve on our public health disease management. We are going to use it to manage tracing and data management. And we are also going to use it to improve the entire primary healthcare system to create a resilient and integrated system that works with all other agencies within the Ministry of Health. Now, the effect on the tertiary sector, on the more advanced area, is going to be probably even more dramatic in that it has become clear from this outbreak that we are actually on our own. There is almost nobody now who can fly abroad if they fall sick. We have to use our own hospitals. We have to learn how to manage our own hospitals. And in managing our hospitals, there are three things that are of importance. First is the funding. How do we fund our hospitals effectively and fit for purpose way? Secondly is the administration. How do we administer our hospitals in the most efficient and productive way? How do we get productivity? And thirdly, how do we use demand? How do we increase demand? How do we make people appreciate the health center? We need, our health system. We need to be able to build confidence in the health system. And in doing all of this, the private sector has to come in. The private sector will play an important role in bringing in funding and management acumen to create something that will have the confidence of the user. It will be like the patient will be like a customer, will be treated with full respect and given all the needs that they require to attend to their individual ailment.
Honorable Minister of Health, Dr. Osagie Ehanire, thank you so much for your time on this Democracy Day. And we wish you the very best of luck as you continue the battle against COVID-19 and indeed other ailments that afflict the nation. Thank you very much.
Thank you very much for inviting me.